Cyclophosphamide, right? Can you
Yes.
give some precautions what we have to take while giving cyclophosphamide? Being a clinical pharmacist, what precautions we have to take during chemotherapy?
Yes, sir. So, cyclophosphamide has the major ADR of hemorrhagic cystitis. So, along
Good morning, students. I'm very happy that we have successfully completed our 30 days oncology, basic oncology and chemotherapy course. So today we will be conducting final viva for distribution of certificates. I think everybody are ready for your presentation and viva. We will begin with Ankit. Ankit, please share your screen and start presentation, and we'll proceed with viva.
Yes, sir. Yes,
Okay, Ankit. Yes, you can proceed with your presentation.
yes, sir, sure, sir. So today my presentation topic is enhancing quality of life, supportive care for chemotherapy patients. First of all, understanding the supportive care. Supportive care encompasses the prevention and management of adverse effects of cancer treatment, ensuring holistic well-being of patients. It focuses on quality of life to maintain or improve the quality of life, allowing patients to derive maximum benefit from the anti-cancer treatment. And the multidisciplinary approach, supportive care involves a team of specialists who work together to address the physical, emotional, and social needs of patients. Role of supportive care in chemotherapy. Managing side effects, supportive care focuses on mitigating the physical, emotional, and financial effects of chemotherapy, enhancing patients' comfort and well being. It optimizes treatment to ensure that patients can tolerate and adhere to their chemotherapy regimen, maximizing the effectiveness of the treatment. It empowers and gives the supportive care, equips patient with the knowledge and resources to cope with the challenges of chemotherapy, fostering a sense of control and empowerment. Supportive care team and the services provided by them. Specialist involvement, patient receive personalized care from a team of specialists, including oncologists, nurses, social workers, and nutritionists. Tailored interventions. Supportive care offers a range of services such as pain management, nutritional support, counseling, and rehabilitation, tailored to individual patient needs. Continuous support. Patients have access to ongoing support throughout their chemotherapy journey, addressing evolving needs and challenges. Nutritional and lifestyle support. It gives them dietary guidance, nutritional counseling, and support to address dietary challenges and maintain optimal nutrition during chemotherapy, including physical activity, encouragement, and guidance for safe and appropriate physical activity, promoting overall wellness and combating treatment related physical decline. And smoking cessation, supportive care interventions to aid patients in smoking cessation, reducing additional health risks during chemotherapy treatment. Addressing chemotherapy side effects. Chemotherapy side effects like nausea and vomiting. Here, in chemotherapy side effects, we will be planning strategies to prevent chemotherapy-induced nausea and vomiting, ensuring patients' comfort and adherence to treatment. Fatigue management interventions to combat cancer-related fatigue, promoting energy conservation, and improve daily functioning of patients, and providing pain relief approaches to alleviate chemotherapy-related pain, enhancing patient comfort and overall well-being. Innovations and future directions in supportive care, like telemedicine, leveraging telehealth platforms to expand access to supportive care services, especially for patients in remote or under-reserved areas. Digital health tool, integration of digital platforms and apps to provide patients education, symptoms tracking, and remote monitoring for supportive care needs. And virtual support communities, creating virtual communities and support groups to foster connections and shared experiences among patients undergoing chemotherapy. And personalized supportive care, like precision in medicine, tailoring supportive care interventions based on individual patient characteristics, genetics, and treatment responses. Predictive analytics, utilizing data driven insights to anticipate and address potential side effects and supportive care needs proactively. patient-reported outcomes, like incorporating patient-reported outcomes to guide personalized supportive care plans and interventions. Thank you. Any questions?
Okay, Ankit, it was okay. Very good presentation. So, tell me one thing: why it is important for the chemotherapy patient to give supportive care? Why?
Which, first of all, it is sir, very important as supportive care provides them with support for any particular having any side effects from the chemotherapy drugs like nausea, vomiting, which we see, and fatigue, and any type of pain which they have. And tailoring these types of supportive cares will enhance the quality of life of overall patients' improvement in chemotherapy, which we are giving. This chemotherapy also chemotherapy will also help in enhancing the quality of life, like exercise planning, and we can also advise them for exercise planning and changes in their daily habits, like smoking cessation to
Okay, tell
stop.
me. Okay, Ankit, tell me
Yes,
few potentially harmful drugs which are having lethal adverse effects. Can you give some examples of chemotherapy drugs that has lethal consequences for which we require supportive care, like giving a patient is given with good diet plan, BP is monitored, and hydration is always suggested for the patient. All these are supportive care, right? Treating
yes,
nausea and vomiting. All these are supportive care management. So, give me some examples of drugs which are potentially harmful, causing lethal adverse effects.
yes, sir.
We have studied a lot of drugs, right? We have cyclophosphamide, methotrexate. Can you give me one lethal adverse effect caused by cyclophosphamide? We have already studied. You don't remember. Okay. Anyways, final question. Ankit, what do you know about life Ramini syndrome? I
Yes,
think
sir.
we studied this. You don't remember. Okay, कोई बात नहीं. Anyways, thank you for your presentation and for giving Viva. You just stay. We will continue with the other students. Okay. You can stop your screen. Next, we will go with Hani Desai. Hani Desai, be ready.
Yes, sir.
Begin.
Good morning, everyone. My name is Hani Desai, and I am from Maliba Pharmacy College, a family fifth year student. Today, I'm going to present over here on the topic breast cancer. First of all, starting with my introduction one, I want to talk about the oncology course. Studying with Dr. Srinivas Nayak sir, it was a very informative session. Each and every session, each and every day which he conducted, gave me knowledge regarding the every drug which was prescribed in the different cancers. Uh, each and every ADR of the particular drug, how the cancer is affecting many people all around the world. And also he also helped me in my project work, which I selected my topic as breast cancer, and I'm doing a project on the risk factors affecting risk factors which are related to breast cancer. So I would like to heartily thank you, Dr. Srinivas sir. Further continuing with my topic of breast cancer. Breast cancer. In this presentation, I will going to conclude introduction, the pathophysiology, the diagnosis, and the treatment. Introduction. It is a malignancy originating from breast tissue. In epidemiology, woman to man ratio is 150 is to 1. There is an overexpression of estrogen, progesterone, and HER2 receptor. In 2023, estimated to 297,790 new cases of breast cancer has been seen, and 90% of breast cancer seen in epithelial cells. Meanwhile, doing my project, I saw more than 7 men over 50 women who were diagnosed with breast cancer. Etiology, the most and prevalent one is the female gender and the increasing age. The endocrine factors include early menarche, delayed menopause, nulliparity, late age at first childbirth, hormone replacement therapy, more than or equal to 15 children, prolonged reproductive life, bilateral oophorectomy, ovarian tumors, chronic use of oral contraceptive pills. Genetic factors: woman with a first degree relative with a history of bilateral breast cancer or lateral side breast cancer, BRCA1 or 2 mutations only account for approximately half of familial inherited breast cancer. Other ones are P53 mutation associated with Life-Remoni syndrome, CHEK2 and PTN mutations associated with Cowden syndrome. Others are hypertension, diabetes, insipidus or mellitus, hyper and hypothyroidism, anxiety, depression, and mastectomies. Environmental and lifestyle factors include any previous radiation therapy if taken, consumption of alcohol, tobacco, cigarettes, consumption of increased amount of animal fats, high calorie food, high breast density, hip size and waist size, breast augmentation surgery, high BMI. Fibrocystic changes associated with atypical epithelial hyperplasia increase to 5 times risk of developing breast cancer. Moving forward to pathophysiology, first of all, the environmental factors, the hormonal changes, the inherited genetic mutations causes damage and failure of DNA repair, thereby causing mutation in genome. Inactivation of tumor suppressor gene, inactivation of growth promoting oncogenes, alteration in genes that regulate apoptosis, which further causes decreased apoptosis and colonial expansion, over here causing unregulated cell proliferation, which further causes colonial expansion, thereby causing tumor progression and malignant neoplasm. Clinical presentation includes painless palpable lump, skin edema, skin redness, warmth, nipple discharge. Patient may not have any symptom. Breast cancer may be detected in asymptomatic patients during routine mammography screening. Diagnosis, there is a triple technique in diagnosis. First of all, the doctor will see palpation. If it's there, then they will go for mammography. In mammography, if it's detected something is abnormal, they will go for fine needle aspiration, then CT scan, X-ray, MRI, USG, and biopsy. These are the stages of breast cancer. 100 stage 0, there is 100% survival rate. In stage 2, 98% survival rate, and stage 3, 88%, and stage 52, and stage 4 is 16%. Classification, there are three types of carcinomas: non-invasive, invasive, and Paget's disease. In non-invasive, we have intraductal and lobular. In invasive one, we have tubular, infiltrating lobular, medullary, and infiltrating duct. In Paget's disease, we have there is mostly it's outside the nipple, and eczematous lesion, crusted and scaly, palpable mass, and invasive, or it may be non-invasive. Moving forward to treatment part, goals of treatment are improving overall survival, minimize symptoms related to disease, minimize treatment failure, improve time to progression, improve overall quality of life. In the management, for stage 1, stage 2, and stage 3, stage 1 we have surgery which has 80% prognosis, for example, Paget's disease. And in stage 2, we have surgery plus 6 cycles of adjuvant chemotherapy. There is a three protocol used over here. According to CMF, cyclophosphamide, methotrexate, and 5-fluorouracil. According to FAC, there is 5-fluorouracil, doxorubicin, and cyclophosphamide. There is an alternate therapy, 4 cycles of doxorubicin plus cyclophosphamide, 6 cycles of 5-fluorouracil, epirubicin plus cyclophosphamide, and the third one, which is tamoxifen, which is administered after 6 cycles of CMF, which is a non-steroidal compound, selective estrogen receptor modulator. With it, there is also an anastrozole, which is an antibody, and tamoxifen is used. The stage 3, surgery, palliative care, radiation therapy, again chemotherapy plus endocrine and targeted therapy. Thank you.
What do you know the difference between BRCA1, BRCA2 genes and HER1, HER2 genes? Do you know the difference between these two? Because your presentation is on breast cancer.
Yes, sir. BRCA1 and BRCA2, so they are halfly related to familial history one, and HER2 and HER1, it is related to patients' individual, which has been inherited during their lifespan.
Okay. So BRCA genes and HER genes, among these two, which gene is a tumor suppressor gene and which is oncogene?
Okay.
First of all, you tell me what is a tumor suppressor gene?
Okay. Um, Sir, tumor suppressor gene, be for example, if it's a P53 gene, they stop cell proliferation, and tumor, tumor suppressor gene, and
Just relax, no problem. Relax and tell me. Just in simple words, you can say what is oncogene and what is tumor suppressor gene.
uh, sir, for example, HER1 and HER2, it is an oncogene which causes breast cancer, and tumor suppressor gene, it can cause cancer, and it is present in cell having a role such as which causes a repairing of DNA, decreases oncogenes, and maintains cell cycle. So BRCA1 is a tumor suppressor gene, and HER2 and HER1 are oncogenes.
Yes, yes, good, good. See, actually, HER1 gene and HER2 gene, if these genes are present in females, they are having high risk of causing cancer,
Yes, sir.
particularly breast cancer, because they are oncogenes.
Yes, sir.
And BRCA1 and BRCA2, these are present already in the females, which are protecting from her genes and which are protecting from other proliferating factors. So
Yes.
BRCA1 and BRCA2 are tumor suppressor genes. These are protecting the human.
Yes, sir.
Okay? अगर इसमें if BRCA1 BRCA2 में अगर mutation comes, these functions of BRCA1 and BRCA2 will be altered, and alteration of this BRCA1 BRCA2 may lead to cancer. Okay,
Cancer.
good,
Yes, sir.
good, 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 good.
Yes, sir.
Okay, you were talking about cyclophosphamide, right? Can you
Yes.
give some precautions what we have to take while giving cyclophosphamide? Being a clinical pharmacist, what precautions we have to take during chemotherapy?
Yes, sir. So cyclophosphamide has the major ADR of hemorrhagic cystitis. So along with the cyclophosphamide treatment, we have to give mesna with it, so that it does not cause or decreases the risk of hemorrhagic cystitis.
Have you ever seen this mesna in hospitals along with cyclophosphamide? Did you see? Did you come across? Because you are doing project on this same topic, right?
Yes, sir. So mostly in the nephrology department, patient comes with but most of the ADR with cyclophosphamide, sir, it is not with hemorrhagic cystitis. It is they are having skin reactions, sir. Their skins become scaly and patched, and patient are complaining for urine retention.
Okay. Yes. Good. So you have not seen the patient with hemorrhagic cystitis.
No,
Yes.
sir, not at the stage of hemorrhagic cystitis, but at the initial stage of urine retention.
Okay. Okay. Good. See,
Yes.
hemorrhagic cystitis is the lethal one, and it is not seen in everybody.
Yes, sir.
If it is there, or if that risk is there, we will start with mesna, and prophylactically we will start mesna with the patient.
Yes, sir.
Anyways, see, for cyclophosphamide, not only this, it has many other side effects. As you told, hypersensitive reactions are there. It may also damage kidneys, and many other hepatotoxicity is there.
Yes, sir.
Okay? Immunosuppressive action is there. Many things are there. Anyways, good. Uh, Last question. See, we have studied about vinca alkaloids, right?
Yes, sir.
Can you tell me when vinca alkaloids are uh, prescribed to the patient? So there is one very important precaution we have to take while administering. Can you talk about that? What precaution we have to take?
Mm.
And about their formulation. There are some very particular formulations for vinca alkaloids. Any
So
idea?
Vincala alkaloids, I know about vinblastine. It's only given through subcutaneous route because if a vinblastine given outside the blood vessel causes phlebitis, and drug administration causes ulcer formation.
Okay. Can you give the difference between vinblastine and vincristin?
Okay.
We discussed that difference also. Any one difference. Okay. Give me one major adverse effect which is associated with these vinca alkaloids. Main adverse effect.
Mm. Sir, neurotoxicity.
Good. 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 Yes. So based on this neurotoxic effect, if these drugs are not indicated in normal parenteral route, in which route we should never indicate these
Sir,
drugs?
so in IM route they are not indicated. Intramuscular route and
And
intrathecal.
intrathecal.
Yes,
Okay,
sir.
good. Okay, good.
Yes, sir.
I'm impressed with your presentation and viva. We will go with the other students.
Okay,
Good.
sir.
You can stop your screen.
Okay. Thank you, sir.
Next, Sanat. Sanat Doke.
Yes, sir.
Are you there?
Yes, sir.
Okay, Sanat. Since you are just second year student, I'll not go in advanced topic levels. See, tell me some basic answers. What is oncogene, Sanat?
Oncogenes are the genes that cause cancerous cells, that cause cancer,
Okay.
formation of tumor.
Tell me something about T53. T53 gene.
T P53 genes.
TP53. We call it
Uh,
T53.
they are the tumor suppressor genes. Uh, they fight against the cancerous cells as a defense mechanism.
Not a defense. Okay. What is guardian of genome?
Guardian of
Guardian
gene.
of galaxy. Who are guardian of galaxies? In the same way, we have guardian of genome, which is protecting the total genome. So you are not concentrating in the class. Okay. Okay, fine. Last question. Tell me what is a neovascularization? सुना है नाम? Neovascularization. You might have studied in pathophysiology. Neovascularization.
No, sir.
ठीक है. Okay. Okay. We will go with other student now. कौन है? Next is AP. Anmol is there?
Yes, sir.
Hmm. See, Anmol, tell me. See, initially we discussed about 7 warning signs of cancer, right? सुना है? 7 warning signs of cancer. Based on these warning signs, we have to be alert. Can you tell these warning signs?
Sir, the first is persistent and unexplained fatigue, then changes in skin such as darkening, rashes, and
Okay, you have not revised. Do you have any presentation to give?
no, sir.
ठीक है. ठीक है. तो और कौन बचा है? Next, I think we have Akanksha. Akanksha, are you there?
Yes, sir.
Do you have presentation?
No, sir.
कुछ रिवाइज किया है कि नहीं?
रिवाइज नहीं किया.
ठीक है, रिवाइज नहीं किया है. Shall I ask you some basic questions? Would you like to answer?
Okay, sir.
Uh, Tell me the adverse effects of methotrexate overdose.
Folic acid deficiency,
Hmm.
bone marrow suppression,
Okay.
और
See, we heard about ABVD regimen. Yes, we studied
yes,
about ABVD regimen. Can you tell me in which disease we give ABVD regimen? This regimen is indicated in many leukemias, right?
yes,
कौन से leukemia में देते हैं पता है? Okay, no problem. See, Hani Desai was telling about cyclophosphamide, which may lead to hemorrhagic cystitis, right?
yes, sir.
And to protect the patient from cyclophosphamide poisoning, hemorrhagic cystitis, we will give Mesna, right?
Yes, sir. Yes, sir.
So, can you tell me why or how Mesna will prevent hemorrhagic cystitis?
वो साइक्लोफॉस्फामाइड है, वो एक एक्रोलिन प्रोड्यूस
Hmm.
करता है जिसके वजह से वो हेमरेजिक सिस्टाइटिस होता है. तो मेसना हैज ए एंटीऑक्सीडेंट वर्क करेगा और वो न्यूट्रलाइज कर देगा एक्रोलिन को.
Very good, excellent, very good, good, good. Tell me something about what we have Life-Ramini syndrome, right?
सॉरी सर.
Life-Ramini syndrome, ली-फ्रामिनी syndrome भी बोलते हैं. ये क्या है? भूल गया. ठीक है. Can you give the difference between acute lymphoid leukemia and chronic lymphocytic leukemia? दोनों के बीच सिंगल डिफरेंस. ठीक है. Okay. No problem.
ये माइलोब्लास्ट ल्यूकेमिया क्रॉनिक में कुछ माइलोब्लास्ट इंक्रीज हो एलिवेटेड होगा.
Myeloblast is different. I am talking about a lymphoid leukemia. वो myeloblastic myeloid leukemia is different. In leukemias, we have 4 different major types, right?
यस AML, CML, ALL और CLL.
Hmm. I'm
और
talking about ALL and CLL.
इमेच्योर जो TB लिम्फोसाइट्स है
Hmm.
वो उसका कंसंट्रेशन ज्यादा होगा.
Hmm. Okay. Give me the risk factors, main risk factors for lung cancer.
मेन स्मोकिंग,
Hmm. Can you give the composition of smoke, which is mainly leading to lung cancer? ठीक है, कोई बात नहीं, चलो. We will proceed with other students. I think we have किया है. I think we have few other students. Trushant, can you hear us? Trushant Pandoria. ठीक है. Prajwal, can you hear me? Prajwal is having network issue, I think. ठीक है. Actually, I was planning to take viva again for students. Actually, for parallel students, exams are going on. That's why they are not joining. ठीक है. But I am very happy with the Ankit's presentation and Hani Desai. You have good. I am impressed. ठीक है.
Sir, may I speak something?
Yes, Hani Desai, you can.
Sir, I was talking about the cyclophosphamide. Na? In the nephrology department, we have Dr. Vatsa Patel, and she's uh, giving drug cyclophosphamide. She's prescribing it for SLE. And patient with SLE, na, who and female patient who are going to conceive a baby, na, she's not prescribing cyclophosphamide due to is having related to something pregnancy related ADR.
Okay. She is prescribing for SLE.
Sir,
Yeah,
SLE, yes.
yeah. It is see, it is a immunosuppressive agent, immunomodulator. So it is given in autoimmune disorders. In SLE, it
Okay.
is drug of choice actually.
Yes, sir.
Hmm. Okay. ठीक है. तो I think Shivani, would you like to answer for few basic questions? I think you are having exam and देखते हैं.
हाँ सर, प्रिपेयर नहीं कर पाई मैं.
ठीक है, no problem. We will give time after finishing exams. Let's see if only for parallel students we will do that. ठीक है. I think everybody were done. Okay. Thank you all for joining. I have 3 certificates. अभी तो 2 certificates decide हो गए हैं. One certificate from parallel we will see. ठीक है. Anybody
Thank you.
anything to say? I think you all received your participation certificates, right?
Yes, sir.
हाँ. ठीक है फिर. We will wind it here. Thank you all for joining, and we'll see. And see, if you have any queries related to review papers or research papers, publication में अगर if you want any help, we will go in some UCG approved journals and Scopus and Web of Science journals. Okay, if you have any case report, anything related to research, and if you have any queries in getting and job assistance also, I'll try to help you. And if you are in medical profession, definitely I'll be there and we will work as a team work. Okay, so कुछ भी हो तो ग्रुप में बताते रहना. You have to keep updating कि what you are doing, what activities you are performing, anything. And
Sir,
always, yes,
sorry for
ma'am.
interruption, sir, but I have a case report on nitrofurantoin-induced pulmonary eosinophilia. The patient was prescribed for nitrofurantoin, which is usually given for 7 days. Patient was prescribed for 10 days, and after 10 days, his IgE antibodies were increased due to nitrofurantoin, a major ADR of pulmonary embolism, pulmonary eosinophilia.
Good. So we will try to publish that. And along with that, see, when nitrofurantoin or these drugs are given, we have to check whether patient is G6PD deficient or not. Patient को G6PD deficient है?
No, sir, he was not GCSPD deficient, sir.
अगर वो नहीं है तो we can go with this ADR and majorly G6PD deficient में hemolytic anemia होता है सबसे ज़्यादा. तो ठीक है, this is quite interesting. If you want, I'll give you some formats. According to that format, you make one manuscript. उसमें कुछ editing वगैरह करना है तो I'll do and we will try to publish. ठीक है?
Okay, sir.
Yes. Okay, then see you. एक चीज याद रख लेना, we फार्मडी ग्रेजुएट्स, फार्मडी स्टूडेंट्स आर ऑल वन फैमिली. याद रख लेना, अगर किसी को कुछ भी प्रॉब्लम हो तो वी हैव टू बी रेडी टू हेल्प अदर्स. ठीक है? सब कुछ प्रोफेशनलिज्म में ही रहना है. पर्सनल इश्यूज ये सब कुछ भी माइंड में मत रखना. ठीक है, चलो फिर वी विल वाइंड इट हियर. थैंक यू ऑल फॉर ज्वाइनिंग एंड सी यू.